Hello, and thank you everyone for coming to the final event of the Psychology Department's Alumni Career Exploration Spotlight Series. My name is Katie Fry, and I manage the Psychology Undergraduate Program. And today we will welcome our psychology alumni, Dr. Melvin Hinton, a licensed clinical psychologist and the current Chief of Mental Health Management Services for the Illinois Department of Corrections. Dr. Hinton has reserved some time at the end for questions, but feel free to raise your hand throughout as well. I will hand it over to Dr. Hinton.
Good afternoon, everybody. We're going to be real relaxed, okay? So I'm going to take time at the end to make sure that we have robust question and answer period, but please feel free to stop me, throw a hand up, ask a question, anything like that throughout. So I am really excited to be here, so I should start off by letting you first know that I'm going to take my glasses on and off a billion times because I'm old and I have to use glasses to see things now and read, but I can see you well. So I just want to start off by thanking the psychology advising team, the psychology majors here, the BCN majors, which I think is super cool, faculty, staff, and alums alike. So I am Dr. Melvin Hinton. I have loved Michigan from the time that I stepped on campus to the time that I left, and now honored to be back. So I'm an alum I've got some cool graphics. Trying to make sure no one falls asleep, right? So I'm an alum from class of 2000, born and raised in Detroit, Michigan. Moved to Chicago in 2000 to pursue my doctorate. Pretty much hasn't left since then. Took a brief stint out in California for my pre-doc internship, but didn't move right back because that's what my wife told me I had to do. So it was easy to do. We're going to spend some time today, since we're talking about career spotlights and career pathways. So I'm going to tell you about mine and how I got into not only clinical psychology, but really forensic, and how that intersection became really powerful for me specifically. I'll tell you a little bit about my day-to-day, because sometimes people get a little curious about working for the Department of Corrections and what I do as the Chief of Mental Health Services. So I'll give you a little glimpse into that. I'll tell you about the need for psychology, psychologists, psychiatrists, mental health professionals within that setting. I think it's super appropriate, specifically given what we have all experienced this week at Michigan State, how important it is for us to be in this field and offering to help folks who have extensive mental health related issues. So we'll talk about that, and then I'm going to encourage you throughout this process to make sure that you're exploring your surroundings, exploring the university, exploring the opportunities. Because right now, particularly in your lives, this is the time for you to go, oh, I like this, I don't like that, you know, that could be cool, I'm not sure about that, and you get to try it, right? So that as you get older and kind of more experienced in whatever the field that you're choosing, you'll know what makes you happy, and that's really important. So we're going to do that, and as I said, make sure you stop and ask questions. So, Dr. Melvin Hinton, I have a doctorate in psychology. I am a PsyD as opposed to a PhD. How many people know the difference, PsyD versus PhD, kind of, sort of? We'll touch on that in a hot second. I will tell you some major differences. As I said, I'm alum, class of 2000. Psychology major when I was here. I was a kind of a weird kid when I first got here, as I've always known I was going to be in psychology. It was either going to grad school or going to med school to become a psychiatrist, but there was never any deviation. I knew that from the get-go, so we'll talk about that. We'll talk about the fact that I completed my master's and my doctorate in clinical psychology from the Chicago School of Professional Psychology, graduated in 2005. I am licensed in the state of Illinois as a clinical psychologist, and I'm going to kind of touch on that. So, PsyD first. I actually learned about the PsyD degree in a seminar like this. I was telling somebody earlier in West Hall in like 96, I think, 1996. Was sitting with a professor, and he said, oh, you should come to this event that we're doing. They're going to talk about the PsyD degree. Never heard of it in my life. It's still fairly new in terms of history. I think it's been around since probably the mid to late 70s. And it really is more practitioner focused, how you work with patients specifically, right? As opposed to your traditional PhD, which is really more research focused. Went to the seminar, had a great time there. Guy was up there and he was telling me the differences and whatnot, and I thought, well, this could make some sense, right? I want to work with patients. I want to help people. I want to see, do I work in a hospital? Do I have private practice? What do I do? This seemed like a great way to go. But it was actually Dr. Wolowitz who was here. I asked somebody earlier, he actually taught interpretation of dreams, which I understand you guys don't have currently, which is a real bummer. It's probably my favorite psychology class ever. But we sat and talked, and I said, there's some things that I might want to do later. What if I want to become a professor? What if I want to teach? What if I want to do research? And he said, if you explore these programs, you might be able to find a program that gives you a little bit of everything. And that's exactly what I did. I found a PsyD program that required a dissertation, required me to do original research, required me to be published. And then I had the best of both worlds, right? So not only kind of my day job as the chief of mental health for the Illinois Department of Corrections, but I also am an adjunct professor at the University of St. Francis, so I teach undergrads as well. And I've never had a situation where someone said, oh, too bad you're not a PhD, or, you're only a PsyD. I've always had a situation where people went, oh, that's fantastic. You're a clinical psychologist, you're licensed. What can we do, right? How can we make this work? So I would certainly encourage you all to explore what makes you happy. What do you think might make you happy in the long term? Dr. Wolowitz, and this is something I've actually told my younger professionals today. Think about what your ideal job would be. What do you think? Doesn't matter if you know exactly what it is. What do you think would make you happy, right? Do you think, you want a couch and, you want to sit and you want to do analysis all day? You want to work in a hospital? You want to work with children? You want to work in the community? You want to do consultations? You want to work with corporations? Whatever the case is, think about what that is now and then start exploring it. Being at the University of Michigan in particular, you have every opportunity in the world to go and try different areas and go, I'm thinking about this, I might want to do this. Explore it. So we'll talk about how I explored it. I will also tell you, just as hopefully this is not something new to you all, I'm licensed in the state of Illinois. I have lived in the state of Michigan. I've lived in the state of Indiana. I've been licensed there as well. Know your jurisdiction. If you think you're going to spend a good portion of your life in the state of Michigan, understand what the licensure situation is here, right, for your chosen profession. If you're going to become a psychologist, psychiatrist, you're going to become a social worker, master's level person, whatever the case is, find out what the requirements are, find out what you can do with that license? Can you practice independently? Do you need someone to co-sign for things for you in order to do work? Know that, right? Know what it will take. You know, do you just have to take your EPPP? Do you just have to take licensure for state exams? Know that, right? And depending on where you go, California, New York, what's another big one? Florida's a huge one. Those requirements may vary. So know that kind of stuff. So how did I get to where I am now? And this is a gross oversimplification of it, but I wanted to use it as a marker. So started here at the University of Michigan, went to a seminar, as I said, heard about the PsyD program, thought, oh, okay, this is good. I think I'm going to do that, right? I'll figure out what program I want later, but now it's time to start thinking about, well, what I want to do in life, right? Before I got to Michigan, I was working in a runaway and homeless shelter. I actually worked there throughout my time here at Michigan with children, so 7 to 17 years old, right? Loved it. After about 8 or 9 years, I was like, yeah, I'm not sure I want to do that anymore, right? That was a tough job. Lots of trauma, lots of tough cases, right? So I started exploring. There was actually an opportunity here in the psychology department to do an internship with the Department of Public Safety here on campus, right? I see a couple folks from the department here. I took advantage of it. I went over, I think I got either 2 or 3 credits for doing that for a semester. I went over, I started working for the Department of Public Safety, I started working around officers and law enforcement there and fell in love with it. I will tell you all are very fortunate. You've got some of the best trained police officers and public safety officers in the country. But it gave me a view, a window into law enforcement, a window into what will become a forensic track for me. So I started working there, ended up working there until I graduated, met some great people. Figured out that I did not want to be an officer. It was not where I wanted to go, right? I knew I still wanted to be in psychology. I knew I still wanted to be a psychologist at that point. So I went to grad school. Got to grad school and started looking around for opportunities there. And lo and behold, I found an externship, which is, as you're still in your training, a little bit of a condensed time period where you can go get training, get real world experience training in different areas. And it landed me at the Cook County Jail. It is the largest or the second largest jail in the United States. And I started working there as a diagnostic practicum student. I was literally giving psychological testing, objective and projective measures, your MMPIs, your Wechslers, your Rorschachs to inmates at the county jail. Loved it, and actually never left. So I walked into corrections in 2001, and I've consistently been there ever since, okay? Cook County Jail, Lake County Jail, both in Illinois, the California Department of Rehabilitation and Corrections. I was actually in San Luis Obispo, California, which is really nice and didn't have to deal with any snow or ice. But I couldn't stay because my wife told me you have to come back to Illinois now, so that was that. And then the Illinois Department of Corrections, where I'm at now. But I didn't kind of just stay on that track. So the theme again is exploration and making sure that you look around. Because when I was in grad school, I also thought, well, maybe I might want to do something different. What if I wake up one day and go, I no longer want to be in law enforcement or working with criminal justice system or criminal justice involved citizens. What if I want to work in a hospital? So I started working in an inpatient psychiatric center, inpatient psychiatric hospital. Loved it. Had a great time, great experience. It's something that I use every day. You lost your, yeah. Did that, loved it, but it was kind of weird because all my patients in the hospital at some point ended up going, hey doc, I used to be in jail, right? And I was like, man, why are all these people coming to me? Why do I find all these folks, right? But it just worked out that way. I also did an externship at Roosevelt University. I worked in College Counseling Center, which I loved. It literally gave me the opportunity, when I was talking about earlier, do you want the kind of couch and do analysis? I had a nice office, right? Pretty much overlooking the lake in Chicago. I had students that would come in. I think my earliest student was at like 8 a.m., take the train into work. It was great. I couldn't have asked for it to be better. But I still didn't have that same passion, right? What makes you want to get out of bed early in the morning? What makes you want to run to the office? What makes you, passionate? It just wasn't that. It kept being corrections for me. That was really important. So back to corrections I go, and then ultimately ended up staying. And so I've been in corrections, like I said, since 2001, and at this point, don't see myself leaving it anytime soon. So, and I'm cognizant of time because I'm going to keep us on track. Chief of Mental Health Services for the Illinois Department of Corrections. So what does that mean? What do you do? What's my day like and all that stuff? So I'm gonna kind of get to that. So right now, as the Chief of Mental Health Services, and I'll kind of shorten the Office of Mental Health Management Services to Chief of Mental Health Services. I'm in charge of all of the adult prisons in the state of Illinois. Not the juveniles, that's a different division, and not state or municipal or local jails, right? Jails, county jails, the sheriffs, that's a different animal. So for the state of Illinois, there are approximately 30 facilities, depending on how you count. One has 2 different sites, but 30 facilities. I'll get into the demographics of the inmate population in a little bit. About 30 facilities, there's about 600, probably 550 full-time equivalents or allocated positions in my division that range from psychiatry, psychology, social work, master's level, behavioral health technicians, activity therapists, nurses, the whole gamut. Because one of the things, hopefully, that you all have kind of heard at this point is when an individual is sentenced to prison in this country, they have a constitutional right to care. Full stop, period. Constitutional right to care. Doesn't matter how sick, how injured, what trauma background they have, whatever they have, once they get into that system, we are required to treat them and treat them appropriately. And so we'll talk a little bit about that in a second. Corrections is it's a tough environment. The amount of trauma for individuals that are incarcerated in this country is through the roof. There is no state that I'm aware of where corrections doesn't house their most mentally ill individuals in the state, including here in Michigan. So my counterpart in Michigan is David Doughty, and we talk pretty regularly. The chiefs of mental health or chiefs of mental health services across the country kind of get together once a year from each state, and we kind of commune and let each other know what's going on, and the numbers just don't lie. The amount of individuals who are incarcerated first is staggering, but the amount of individuals incarcerated who require mental health services is through the roof. So I got a couple of quick statistics up here for you. I won't bore you to read, but I will just again highlight jails and prisons house the largest concentration of mentally ill individuals in the U.S., and it's not close. More than the Department of Mental Health, more than Human Services. Right now in Illinois, there are approximately 13,000 individuals on the mental health caseload out of 30,000 total individuals that are incarcerated. So that's roughly 43%. 43%. So I always say we're in the business to put ourselves out of business, and we're falling short, right? We're always inundated, and the more people that come into prison, the more you start to see their mental illness. This chart here is by far, this actually is from data from I think 2012. So I know the Department of Justice is in the process of updating it. But you pretty much see this across the country. The more people are incarcerated, the number of times that they are incarcerated, the higher likelihood that they have some mental health history. And when you start getting to 3 and above, it becomes really, really apparent, right? And in some ways that makes a lot of sense, right? Most people, if you interface with law enforcement, you're unfortunate enough to go to jail or go to prison, most people will kind of go, I don't ever need to do this again under any circumstances, right? Folks who are mentally ill, specifically those who are seriously mentally ill or have serious and persistent mental illness, it's a little bit harder for them to kind of comprehend that, a little bit harder for them to adjust within society, and they end up going to jail or prisons, right? What do I see? I'm not going to read this list to you because hopefully everyone here is familiar with the DSM, right? Everyone? That's what I see in prison. Everything in the DSM, right? Schizophrenia, neurodevelopmental, substance-related, dissociative disorder, personality disorders, you name it, that's what we deal with. And sometimes in some of the most severe cases that certainly in 20 plus years I've ever seen, right? And again, we don't have the ability to say, oh, this person is too sick. This person is self-injured. They, are clearly psychotic and clearly shouldn't be in prison. That's not how it goes. We're the only one at the table that doesn't get a say. Once the judge sentences you to prison, you're here with us. And we don't get a chance to let you go until you've paid your debt to society, or somebody who's a judge in good standing decides, okay, there's a compelling reason to let you out of prison. Otherwise, we have to treat that. So it's not just about treating in a very specific way. Like you'll hear folks say, well, I only want, cognitive behavioral therapies, or only want strictly behavioral therapies. What we have actually found is shocking. Everyone's different, right? Some people respond very, very favorably to behavioral approaches. Some people find favorable responses to more family systems oriented therapy. I'm more of a psychodynamic person, trained. So we use a little bit of everything depending on what the need is of that particular patient. So don't feel like, if you are in one particular concentration or school of thought, I should say, that you can't use that. The way the department is structured, the mental health delivery system is structured in Illinois, there are multiple levels of care, right? There's an outpatient, There's a crisis level of care, there's a residential treatment unit, a modified residential treatment unit, and an inpatient level of care. Now, when I say outpatient, sometimes people start thinking about the community and you go somewhere. Everything happens within prisons. Everything happens within the system. But depending on what your needs are, that dictates what level of care, how much services you get, the type of structure that you are subjected to, so to speak, within the system. So inpatient is your highest level of care. Think of your psychiatric inpatient hospital. That's what we create. We actually just built a brand new psychiatric facility in the state of Illinois. It's actually the first of its kind. And so I'm able to house roughly 150 individuals there that are the most acute. And we have residential treatment programs that also encompasses our behavioral management unit. So folks who strictly is not a good word, but primarily are behavioral challenges, they go there. And then we have outpatient, which is generally the highest percentage, right? That's most folks within corrections will be at general population settings throughout the state. So we utilize, as I said, several different approaches. Linehan's model for personality disorder, for borderline personality disorders. The only thing we haven't done yet for persistent depression is ECT, but it's actually something that we are capable of doing, but we haven't had a case where that has become necessary yet. But again, all of those things are possible within corrections. What's my day-to-day? So as chief of mental health, what do I actually do, right? And this is not a comprehensive list, but consultation, right? I am consulting with multiple jurisdictions, not only within state, but out of state. I actually do consult with jails, prisons, with the BOP, Federal Bureau of Prisons. I've consulted with other law enforcement agencies, courts, judges, state's attorneys call regularly. Hey, what happens if we have a person who is suffering from da-da-da-da, where should we go, that type of thing. So do that quite often. Supervision, certainly all of the FTEs under my division, at some point I interface with them, make sure that they are following policy, make sure they are doing what they're supposed to do. But I have a team for that. So psychiatrists, I have a chief of psychiatry. I have him, Dr. Puga. I have him do the supervision consultation for the other physicians, social workers, psychologists, master's level, nursing, you name it. We have folks that can do that. Policy and procedural development, that's probably one of the biggest ticket items for what I do. Literally am in charge of creating all of the mental health policies and procedures for the department. For the last 10 years, we've really been starting over, building a mental health delivery system. There was some issues before I got there. We wanted to make sure that people were getting the services that they needed and getting it in a proper way. So we redid every aspect of mental health service delivery, from screenings to evaluation to med distribution to scheduling for group therapy, individual therapy, you name it. We've done all of that and always continue. That's an ongoing process of improving it. Testifying, that's a huge thing, right, for judicial commitments. Sometimes you even have to testify about competency and things of that nature. So constantly in and out of courtrooms. I kind of like to tell people I keep 4 lawyers on speed dial just in case somebody calls me and says, hey, can you answer this? Can you do that? yeah, once I check with my attorney first, and then they'll let me know what I can do, right? It's good to know the other disciplines and how you interact and interface with them. Contractual manager, so it is very common, and as you guys explore different pathways, whether it's into government world or private sectors, you're going to find that there are contractual companies, healthcare companies, throughout the industry, right? In corrections, it is very common for state, or not the federal government, but certainly state, local jails to contract with healthcare companies that will provide physical health, mental health, dentistry, optometry, so on and so forth, comprehensive care to the inmates or individuals in custody. So I have to manage that contract. The training presentation portion, this is something that I really enjoy, to be able to sit with my officers, teach them about mental health. What you guys probably think of as pretty basic ideas of understanding about behavioral health, mental health, psychology. There are people outside of this major, outside of this group, that have no idea what you're talking about, right? People, they see something on television, they go, oh, that person's just really ill and whatever. We actually can teach them, give them a foundation, not to be psychology majors or psychologists or psychiatrists, but so that they can interface with the individuals in company and realize, oh, okay, this person does have some mental health issues, right? This person may not be able to comprehend things like other folks, right? And maybe make their job a little bit easier, and make sure that the patient or individual in custody is treated with dignity and respect. That's super important. Also, interfacing with our colleagues, right? Making sure that their education is still top-notch, that they are introduced to new ways of doing business, new concepts within psychology, psychiatry, social work, and just our overall industry. Committee members, I'm on tons of committees, right? So my director gets to say, hey, Dr. Hinton, I want you to go and be on the Illinois Mental Health Task Force and represent us, which is great, right? So I get to interface with other government agencies, initiatives by the governor, which is fantastic. Mental Health Task Force, Suicide Prevention, Community Partnership Task Force. There are a number of them. Bureau of Justice, on the National Institute of Corrections. So a number of those type of things, and it really does give you a window into other jurisdictions, and allows me to kind of share what we're doing in corrections. I think oftentimes people have a very skewed idea of what prison is in terms of mental health, and people go, oh, they're clearly not doing what they need to do. They're clearly, not giving people the treatment, and that is just not the case, right? What we're seeing again is some of the most mentally ill folks in the country concentrated within corrections. And then patient evaluation, probably the most important portion of my job is still interfacing with patient and patient cares, making sure patients are actually getting diagnosed properly, getting an individualized treatment plan, seeing their multidisciplinary treatment team members, right? I don't want my patients only knowing one person on their treatment team. I need them to know the entire team. Who's the nurse? Who's the physician? Who's the psychologist? Who's the social worker? So on and so forth. I need them to understand that entire process, and I need that team to understand who their patient is. And so part of what I will do is make sure, kind of spot check, make sure that my professionals are actually doing what they're supposed to do. And I will tell you, they are pretty receptive to that, right? I don't kind of walk in and go, oh, I'm the chief and I know everything. No, I walk in and go, hey, I'm Dr. Hinton, you're Dr. So-and-so or nurse such and such. Tell me what's going on so that we can kind of all problem solve whatever the case is together. So I'm cognizant of time. Let me pause here because we should be at question and answer period at this point. Any questions thus far? No? Okay, go ahead. Oh, okay.
Thank you. Oh, it works. All right. Hi, Dr. Hinton.
Hi.
As someone who, as you alluded to earlier, has spent a good amount of time in Lake County, Illinois. I'm from Beach Park. I went to Warren. I imagine that the Highland Park parade shooting really was hard for you.
Yeah.
So how do you, obviously you're a very empathetic, grounded person as it's come across here. How do you, I don't know, extend your empathy to extreme cases like that?
Excellent question. You all, as students, you no longer get to just go, oh, there's only one side of the story. That's now erased. You are now required to understand the entire picture. So Highland Park shooting that happened at Michigan State, shooting that happened Sandy Hook, whatever the tragedy, once you step into these roles, you no longer just get to go, oh, that person must be evil. You have to now start to understand that person, that situation, where they're coming from, what's their psychological makeup. And once you do that, then you start going, there's some real disturbances here, right? That doesn't excuse, that's not, rationalizing, that doesn't say, oh, don't blame, none of that. It's saying that you have an understanding, right? You start to see the trauma that people have endured, got them to that point. You start to see the isolation. You start to see the hurt and the pain that they're dealing with. And then you start to go, oh my goodness, yeah, if we only could have done X, Y, and Z. If we only could have figured out how to show that person some empathy, some compassion, right? If we only could have reached that person before they got to this horrific point in their life that impacted so many, it gives you a different perspective, right? I've met some people that's done some very heinous things in the world, and then you start talking to them and you start going, oh wow, you've actually been abused from conception through your adulthood, every day of your life. That's real trauma, right? And you start to see how that affects a person. So you take your time. I'm also human, right? So I'm not Superman or any of that other kind of stuff. I find ways to, appropriate and positive ways, to debrief, right? I have colleagues, I talk to people within the field, talk to my colleagues around the country, make sure I don't take that stuff home, right? And I encourage all of you, as you think about your career, never bottle that stuff up and think, oh, it never affects me. It does. It absolutely affects you. It'll affect you in ways that you're not quite sure. And I'll give you an example. So I have a 12-year-old at the house, my wife, who's also a Michigan alum and a psychologist, but for a long time didn't work in corrections or forensic settings, right? Actually worked with children, specifically female children. So when my son came along, I realized that there were certain things that I would do that my wife thought was strange, right? When people would come up to my son, they'd go, oh, he's so cute. I'd go, you're getting kind of close. I'm not sure why you're touching my son. Why is he so important to you? Back up a little bit. And I remember my wife going, everyone's not a criminal. Everyone doesn't have malintent when they come up and say hello or shake your hand or something like that, right? I had to kind of be reminded of that, and I had to make sure that I'm not bringing that home, right? Nothing wrong, in my opinion, with kind of being aware of your surroundings, knowing what's going on, right? I don't stick my head in the sand and pretend like, everybody is, great, but I also know that everybody's not with malintent, right? So you got to figure out how to debrief. You got to make sure that you understand the entire situation, not just one aspect of it. It's certainly something for younger professionals within corrections that have to remind them, yes, this person is charged with whatever, they've been sentenced to our custody, but it's not our job to like re-sentence them or punish them, right? It's our job to understand what their needs are and to try and get them some help. So I hope that answers your question. It does make me kind of think most folks within state correctional facilities are going home. And I want to make sure that you guys really hear that point. Whether it's Michigan, Illinois, Florida, whatever the case is, most people who are in prison in a state agency are going to go home. So it's our jobs to make sure that they are going back into society a little bit better than when they came in, right? And I take that seriously, right? The amount of people who are incarcerated in this country is staggering. And we can do a whole nother lecture on that topic alone, right? But that's the reality of it. So you have to know that people interface with folks who are just as involved almost every day. It would be rare if no one in this room knew someone who had some interface with the criminal justice system in this country. That would be rare. So they're all coming back to the communities that we live in, right? We have to make sure that they're a little bit better. Yeah, so good question. Other questions? Don't be shy. Yes, ma'am. Oh, we got a mic.
Hello.
Hello.
Thank you for coming out and talking to us. So similar to this student, I'm from Chicago.
Oh.
And so I'm from the South Side specifically. So like I kind of see like the rotations between like the school to prison pipeline and like,
Yep.
Things of that nature. And as you mentioned, we can't save everybody before they get to prison. And so I really liked your lecture up to this point. But I just want to ask, like, for your legacy, like what is something that you want to leave behind, like once you kind of finish in this point? Like what's something that you want to walk away from knowing that you kind of influenced the Illinois Department of Corrections system at least?
Yeah, it's funny, kind of from a developmental perspective, you get to a point in your life where you start thinking about, what do I want to kind of leave behind? And that's a pretty complicated question. What I want to leave behind probably the most is that good care is accessible. That's probably the most important thing, right? Regardless of where you are, certainly within my prison system, I want folks to know I can access care. I can get help. I can see a mental health professional. I can get treated appropriately, responsibly, ethically. I want that to no longer be a question of, do I have to know the right person? Do I have to say the right thing? I want them to be able to walk through any door and get treatment, appropriate treatment. So that's probably the most important. But I also think it's to make sure that staff, including the mental health professionals, and I'm kind of using that as the global umbrella, I want to make sure that they understand that they are dealing with patients, people, not inmates, offenders, individual in custodies, those people, patients, people. I want them to always remember that so that when they're interfacing with someone, they go, if I were here or my loved one was here, how would I want to be treated, right? Dignity, respect, given the appropriate time, answering questions, things of that nature. That's important to me. And I think probably the last thing is I want my patients to go, and the patients within the system, I want them to go, I connected with her. then I can connect with somebody else, right? This is the step, not the final step, just a step, right? Most people are going to go back home, as I just said. I want them to be able to go back into the community and go, I should probably get in touch with my community mental health provider. I should get in touch with my primary care physician. I should get in touch with whomever, and then know, oh, I built a rapport with Dr. Hinton. I can build a rapport with Dr. Smith. You know, I was able to work with Nurse Jones. I can now work with Nurse, Brown or Bowman or whomever, right? Because sometimes people have never interfaced with mental health providers, or sometimes their experiences have been less than favorable, right? I've got tons of wait time. I've got, people don't listen to whatever I've had to say. I want them to leave here and go, I can advocate for myself. I can establish those rapports and relationships with other people, and I can continuously get better. So yeah, that's a complicated question, but I guess that's where I would be at this point in my career. So yeah. Other questions? Anything? No?
I'll ask one.
Okay.
So you mentioned your externship experience at DPS, and I wonder if there's any opportunities for undergraduates to have internships or externships in the Department of Corrections where you're at now.
Yeah. So undergrads in our system, not so much. Lots of grads. So I've got folks in their master's programs for social work and psychology. I've got pre-doc and post-doc internships. Don't have a lot for undergrads at this point, just because of the nature of what we do. It requires now for you to be licensed or pursuing your license, whether it's doctoral or social work degree. But jails do. Certainly a lot of jails have those opportunities where people can come in, interface with that mental health delivery system. Court systems certainly do, where you can go in, work within a specialty court or with a particular state's attorney or judge. I certainly would encourage you to do that. And certainly law enforcement in general, right? Everyone's kind of heard of the ride-along programs. They're still out there. The different scouts, or I forget what they called it in Warren, but you can kind of go say, hey, I want to see what it's like to work in a jail or work with law enforcement, and there's opportunities to do that. I encourage you always to explore those. Find out if this is even something remotely that you would be interested in, right? For corrections, I'm going to tell you, everybody doesn't do well with locked doors, right? You can't just walk into a prison and go, oh, you know what, where's my cell phone at, right? We don't do that, right? You can't just walk into a prison and go, I left something in the car, I'm going to run out to the car real quick. That's not how it works. And some people have a hard time with that, right? Being buzzed in and out, subject to search, being tracked. People have a hard time with that. So find out if that's something that you would like. Working with law enforcement, that's a paramilitary system, right? Some people thrive in that. Others find that to not be a turn on, right? They're like, following orders without questioning. That's a big deal for some people. For others, that's going to be right up their alley. I would encourage you all, particularly most of you are kind of traditional college-age students. If you ever thought, I'd like to work for the DEA or Secret Service or whatever, FBI, now's the time to start doing that, right? Now's the time to start exploring those career paths. It's a lengthy process. It's a process that requires lots of background checks, lots of investigations. The earlier you start, the better off you are. So hopefully that answers your question. And I will certainly tell you, the longer you kind of stay in this field, from an educational standpoint, the more information you'll get about internships and externships and the requirements, right? How many hours, 2,080 hours, 956 hours, or 1,564. You'll be able to rattle them off your tongue because you're like, oh, if I ever want to graduate or ever want to get licensed, gotta have this requirement in place, right? So again, know your jurisdiction. So, anything else? Nothing from this side of the room? Smiling faces? Nothing? All right. Well, I certainly want to thank you guys. I think I have, did I do? Yeah. So I certainly want to thank you guys for giving me the opportunity to come and present to you all. This is truly inspiring, and for me, full circle, right? Being on that side of the room and kind of listening to folks lecture here, and then to be able to come back and do this for you guys is a true honor for me. So I want to thank you guys for that, but I will be around, and if there's any questions, feel free to come up to me, and I'm happy to answer.
Thank you so much, Dr. Hinton.
Thank you. All right.